Here is your stem. There are more than one slide, so please, once you're ready, once you've read this, please tell us. We'll move on. Yes?
Yes.
Yeah. Here.
Okay.
Both ready? Oh, sorry. Wait, there is one more.
Yes, ma'am.
All right, so both ready?
Yes.
All right, so if you've read and understood, considering it communication skill station, please begin.
Hello,
Hello.
I'm Dr. Naveed, one of the surgical doctor working on behalf of Mr. Smith in Manchester Infirmary Hospital. I'm calling to speak to Mr. Mann, a vascular surgeon on behalf of a patient to seek advice. Can I confirm if I'm talking to Mr. Mann?
Yes. Summarize your case.
Yes, we have a patient here who presented after a road traffic accident.
Yes.
He's a
Continue.
20 years old boy. He presented in an unconscious state. Initially, his GCS was 15.
Continue. Yes.
Initially, uh, initially on admission, his blood investigations were normal, except his CRP was raised. He is stable, and on examination, we found that there were a few abrasions on the right flank. Along with this, he was having abdominal pain, which is worsening. After sustaining road traffic accident, he also suffered an open tibia and fibula fracture. And on examination, we found no pulses in his extremities. And we are seeking a help to transfer this patient under your critical care.
Okay. So, doctor, tell me, what have you done for this patient so far?
We have resuscitated this patient
Okay.
and we did ultrasound scan and we found free fluid in his abdomen.
Okay. Okay. So what is the most urgent things right now?
At the moment, we are suspecting that he's having vascular injury, and to prevent this patient from losing his limb, we immediately want to transfer this patient under your care.
Okay. So what else besides vascular surgery that cause the pulseless neck of this patient?
Sorry, I can't hear you.
What else besides vascular injury could cause no pulse in the leg?
What else can cause
I'm still
pulseless?
unable to.
Yes. He's saying what else can cause pulseless injury?
What else can cause?
What else might be the cause? Yes.
Also, we also did ECG of his heart, and we found that there is atrial fibrillation.
Okay.
We are
So
suspecting that atrial fibrillation can also be a cause of his acute limb ischemia.
okay. So tell me, as this patient is a road traffic accident, have you checked his cervical spine?
Ma'am, I can't understand.
Have you checked his cervical spine?
Yes, we did. We resuscitated this patient according to ATLS protocol, and we immobilized his cervical spine, and we performed X-ray of his cervical spine, and there was no bony fracture there.
Okay. Okay. So what else you want to do before referring this patient for me? What investigation you want to do?
I will keep on checking his abdomen. I will
What investigations you want to do? What tests?
I before if we suspect if there is any mesenteric ischemia, we would like to perform CT angiography of his abdomen after confirming that the renal functions are not deranged.
Okay. For here, what investigations would you ask for? For this one?
I would also perform arterial Doppler of his lower limbs,
Okay,
Okay.
good. And
if the if the renal functions are not if the renal functions are deranged, I would like to do abdominal uh, duplex, abdominal arterial duplex, to find out if there is any mesenteric ischemia.
okay, just forget abdomen for a second. Just focus on the legs. One, you said duplex. Okay. What else can you do? CT,
CT
lower limb
angiogram.
angiogram. Yes, this is what he was asking. Good.
Okay. So Mr. Naveed, Dr. Naveed, what other doctors you want to involve in this case?
I would like to involve ITU registrar for this patient and
Okay.
anesthesia consultant
Okay.
and cardiologist because the patient is having atrial fibrillation.
Okay.
And
And I will start uh, cardioversion for this patient and anticoagulation before and to get it completed before transferring to your care.
Okay. So this patient has initial loss of consciousness. What tests you want to do and who you want to involve?
initially
I
conscious.
I would also like to involve orthopedic surgeon for this patient.
Okay. So what about the open fracture? What do your plan of management?
This open fracture, how would you manage that? What is your plan of action?
For the open wound fracture, I would irrigate this patient with normal saline, irrigation of the cleaning of the wound with normal saline, and I will give this patient intravenous antibiotics for prophylaxis, and I will cover the wound temporarily with dressing, and I will call the orthopedic surgeon for an external fixator to immobilize the fracture site so that there is no further injury to the soft tissues.
So, okay, why did you choose external fixation?
Because this is an open wound fracture
Yes.
along with suspicion of vascular injury. This is the reason the skeleton should be stabilized.
Okay. So, what blood test do you want to request? What blood test you want to request?
Sorry, I can't listen.
What blood test
What
you
blood
want to
tests
request?
you want to request? Would there be any blood tests you would ask for?
I would like to send baselines for this patient, like full blood count, U&Es, liver and kidney function tests, and blood and wound swab.
Okay. So, about the abdomen, you said that you found fluid collection with ultrasound. So, what do you suspect might be the cause of this?
Yes.
There is a possibility that he might have sustained an abdominal viscous injury, and more probably he has ruptured his spleen because there are a few bruises on his chest.
Okay.
Good.
Okay. Okay. So, would you involve the general surgeon in this case? Would you
I will
involve the general?
also, sorry,
Yes. Why would you involve general surgeon in this case?
because there is a possibility that in the abdomen there is a visceral injury.
Okay.
So I
One.
would involve the general surgeon.
Yes.
I will involve the general surgeon if this patient would be needing a laparotomy.
Yes. One. And give me
And
2 or 3 more reasons why you need general surgeon.
if there is any ongoing bleeding inside the tummy, I will call the
Okay.
surgeon. I will involve the surgeon to stop this bleeding. Or
Okay.
if there is any viscous damage, the patient might need a laparotomy.
Yes. Laparotomy is 1. And then bleeding. Okay. Ongoing. Then 2. Then 2 more. 2 more reasons. Because here extremity is cold and pulseless and pale. So what might be the reason behind that? There could be
Hypovolemic shock.
compartment syndrome. So
Compartment
one, you
syndrome.
need that. And then there are gross soilage. See, this is fracture, but the wound is gross and soilage, like wound needs debridement as well. So for wound debridement, compartment syndrome maybe, and emergency laparotomy. So you need general surgeon. And if there is bleeding, all right, general surgeon. So general surgeon you need all for all these reasons, right?
All right.
Yes.
Okay. Okay. So, final question, Ms. Naveed, would you involve plastic surgeon in this case, and why?
At the moment, the patient needs his limb to be preserved. So
Okay.
I would be concentrating for his limb, and once once he becomes stable, and after fixation of his tibia and fibula fracture, for the wound care, and after the stabilization of his tibia and fibula fracture, I would like to involve the plastic surgeon.
Yes, why?
Okay, why?
Because the wound is contaminated, and
For
there
the
is a
grafts.
possibility that the skin may become porous, and yes, for the graft, he might need to cover the bony part
Yes.
by plastic surgery.
Yes. Good. For grafting. Yes. Any more questions you have?
Do you need a CT brain?
Yes.
Sorry, CT?
Yeah, CT brain. Would you like to order CT brain?
Yes, because the patient has this patient is a multi-trauma patient, and I would also like to perform CT along with the CT abdomen and pelvis. I would also like to perform CT brain for this patient to rule out any head injury.
Yes. And patient also presented unconscious initially. So, yes. Very good. Okay. In your opinion, do you think patient is dehydrated?
In my opinion, the patient has open tibia and fibular fracture, and there is an ongoing bleeding. There is a suspicion of an ongoing bleeding inside his tummy. Uh, he's developing hypovolemic shock.
Very good. What grade?
Although we have resuscitated this patient,
Yes. Yes.
but he might need further resuscitation later on.
Very good. Good. Yes. Are you done with the questions, or do you have any more questions for him? I think he's doing good.
Okay.
If you have any questions more, you can ask him.
So So what's your plan of management of his abdomen? He has fluid collections, and you have done ultrasound, and you want to do CT. What else do you want to do?
Till the patient is transferred to your care, I will do serial abdominal examination,
Very good.
Yes.
and I will keep checking his vitals. I will do the vital monitoring, and I will keep an eye on his urine output, blood pressure, heart rate, and
Then quickly
Okay.
mention all the vitals. Yes, good.
Okay.
Ultimately, in the emergency laparotomy. Good. Very good. Okay. Thank you so much.